welcome. We are happy to have you here today. Thank you for joining us. I'm so excited to have you and have this conversation, give you a great overview on fertility and the services we offer at Kindbody, and then really talk about self-love. This is the month. I feel like it should be every month, but we're going to highlight it, and we're going to live our best lives today and talk about self-love today. So welcome, and thank you so much for joining us. Feel free to put in the chat where you're from, because we'd love to see where you are from coast to coast. We're gonna get started in just a couple minutes, but I'd like to introduce our amazing panel. I'm so very happy to have everyone here. Dr. Meredith Brower is our physician out in Los Angeles and Santa Monica and Century City. We have Shanae Alexander, who has frozen her eggs with us, and she's going to talk about her journey. I've got Sophia Adler, who is one of our amazing holistic wellness practitioners. And then I've got our wonderful duo from Alonza Wellness. I've got Catherine and Brittany, who are here, and they're going to talk about their journey. They wrote an amazing book called Everything Egg Freezing. I know I was going to get caught on the alliteration. But welcome, 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 everyone. Thank you so, so much for joining us, and excited to have this conversation. And we appreciate you taking the time to meet with us today. So, oh, and Dr. Raquel, oh my gosh, I had to slide down. I had to scroll down. I'm so sorry, right when you're drinking your coffee. Dr. Raquel is here, our wonderful, I'm sure that's some sort of matcha tea or herbal, because you're being the naturopathic doctor that you are. I'm certain it is something wholesome and delicious. Yes. So we're going to talk to Dr. Raquel today and talk about nutrition and self-care. We're going to talk about wellness with Dr. Sophia. You're a doctor now, Sophia. And talk to Sophia about wellness and meditation. And we're going to do some nice breathing, mindfulness with her. And then I'm excited to also introduce you. The Kindbody team has really coast to coast. We're growing. And so amazing that we're just having more people. Again, patient care is number one to us. So we're just learning and growing. I've got two new members of my team. I've got Kylie and Jenna. They're our field reps that are out on the West Coast. Amanda Lynn is brand new to our team. We did trial by fire, and she's literally been here a few weeks, and we've already got her wrapped up into 3 separate events, opening events for our new location in Los Altos. So we're keeping her quite busy. And my ultimate partner in crime, Rebecca Silver, who she and I have been working on all of our virtual events since the pandemic. And again, are you able to come off mute? There you go.
Thank you. Hi, everyone. Welcome. Happy Wednesday. So I'm going to lead us in a really short grounding mindfulness meditation. And I just want to put this practice into context. I'm going to largely guide you to focus your attention on the breath. And what I love about meditation, and why I believe meditation is one of the best self-care practices, is because we're ultimately checking in with how we're doing. We're listening to our bodies. Our bodies know how to breathe and are hopefully always breathing. So when we meditate, we're able to let the mind relax, drop into the body, hear its wisdom. That's also a way to check in on ourselves, to get quiet and just ask, how am I? What do I need? All while just helping us come back to center to take care of ourselves and then move forward with the rest of our day or whatever we're doing in the moment. So just begin by making yourself comfortable. If you're seated in a chair like I am, uncross your ankles and knees so that you can feel the weight of the feet on the floor. Sitting up straight. Hands resting in the lap. Softening the eyes closed if you haven't already, but you can also keep the eyes open if that feels good. Hazy, unfocused gaze down the tip of the nose. And just feel the weight of the feet on the floor. Soften the belly. Notice if you're holding any tension there. Drop the shoulders, unclench the jaw. Allow the tongue to fall away from the roof of the mouth. And bring your attention to the feeling of your breath. Placing your awareness on the physical sensations of every breath in and breath out. Continuing to inhale and exhale. If the mind gets distracted at any point by a thought or feeling, emotion, external sound, that's totally normal. This is a practice of beginning again. So notice the thought, let it go, and just bring your attention back to your breath. Allow the body to do its thing as you inhale and exhale. Breathing in and breathing out. Reveling in the simplicity of reconnecting to the breath. It's both a consistency and rhythm within us that we can always rely on. Inhale and exhale. Let's take one more final breath together. So exhale all of your air. Deep breath in and deep breath out. As you're ready, just start to reintroduce subtle movements into the body. Come back to the space, fluttering the eyes open. And remember, we breathe together in here or when we meditate so that you can go then and breathe through it out there. Your breath is always there for you, and it's the easiest way to check in with yourself and see what you need. Excited to be here with all of you today.
Thank you so much, Sophia. That was great.
You're welcome.
I, for one, am very grateful to have 5 minutes to pause in the middle of my day to do that. And we're going to get into a lot of different, the goals of today is that I'll just take a few minutes to talk to you a little bit about Kindbody, to talk to you a little bit about various options for fertility treatments and fertility preservation. But really what we want to talk about is self-care, self-love, optimizing health, optimizing fertility, and optimizing yourself in preparation for any kind of treatment cycle that you might do. And we have all these wonderful people who have taken time to be with us today, who are experts in meditation and experts in nutrition and wellness, and people who have themselves done fertility treatments who are going to share their perspectives. And we're so grateful for that. But I have to say, just on a personal note, I think mindfulness, I think meditation is one. I agree with Sophia. I'm here to agree with Sophia, and that I do think that meditation is one of the simplest ways to take care of yourself. And I know in my life, I brought mindfulness into my life at the beginning of my fertility journey. It's when it got introduced, when I started doing it. And it doesn't take very long. That's the kind of the amazing thing about it. It is, I'm sure Sophia can attest, and we'll talk to her more about it in a minute, but 10 minutes at the start of your day, 5 minutes at the end of your day. And I actually truly believe it can change your entire physiology and how your body kind of makes it through the day. So Thank you so much for that, Sophia. And we'll hear a little bit more from her later. So again, as Tracy said, I'm Dr. Meredith Brower. I'm one of the fertility doctors at Kindbody. I'm here in Los Angeles, between our Santa Monica and our Century City locations. And again, we're so grateful to everyone who's joined us today, both our guests and our speakers. And as I mentioned, my job is to introduce you just a little bit to Kindbody and the various things that we do here. You've met some of our team members already today. There are many more of us. All of us are sort of dedicated to this mission of trying to make fertility care, women's care, but especially fertility care, accessible, warm, welcoming, unintimidating. And to sort of disperse information. We want everybody to understand their bodies, understand their reproductive health and their reproductive choices. And we want to, again, make that information easy to get and not intimidating to access it. So that's largely what we're trying to do here. At Kindbody, we do offer a full spectrum of gynecologic and fertility services. So, we do offer general gynecologic care. Our fertility care is everything from preconception counseling for people who are thinking about getting pregnant and just want to optimize their health and know how to do that, to fertility preservation for those who aren't ready to conceive but want to preserve, to taking care of individuals and couples who are having a hard time getting pregnant or just need some assistance getting pregnant. So a lot of our LGBTQ community, they don't necessarily have infertility or any difficulty getting pregnant, they just need assistance. So we offer that full spectrum of services and care here at Kindbody. I think, again, part of our mission, a huge part of our mission is to give people information, right? So as women, much of our lives, you get a lot of information about how to not get pregnant, right? Probably everyone in this room knows a lot about how to not get pregnant, but when it comes to the other side of that, what I would argue is the flip side of the same coin, we don't have a lot of information about what it takes to get pregnant or what happens in the normal process of ovarian aging, what happens with fertility, how do you evaluate that? So everybody's journey always starts with getting information, learning about these things in general, and then learning about their bodies more specifically. So again, we would argue that no matter what your journey is, if your journey is just to get information or it is to do some sort of treatment, we always encourage everybody to come get the information. And that always starts with an evaluation, an assessment. So at an initial assessment, you would meet with one of our fertility specialists, and they would try to, whichever provider you meet with will want to get to know you, would want to get a sense of your personal reproductive goals, and then start to learn about your ovarian reserve. And that happens in the way of an ultrasound, as well as some blood work commonly, where we're trying to get a sense of your egg numbers. Again, that's where we would also start the sort of process of optimization of your health and your fertility. Preconception testing, conversations about the resources for nutrition and wellness. We have all these wonderful people on our team who are also experts in that. And that's where all these conversations begin. Now, again, the evaluation will be tailored to every individual and their reproductive needs. So if that individual is trying to get pregnant, if they have a male partner, it would often involve testing of the male partner, potentially checking on the uterus, trying to get pregnant. So again, that's sort of the first visit, is understanding you and starting to get you information about yourself and where you are in your journey. I hate this slide because it's depressing, but I always often am starting conversations with saying, the reason that we are talking about this, the reason that we're wanting people to have an awareness of what I refer to as ovarian aging, is that for all females, we're born with all the eggs we're ever going to have. We don't get to make any new eggs throughout the course of our lives. It's actually different from men. Men have stem cells in their testicles and they get to generate new sperm throughout the course of their lives. Totally unfair, but it is the way it is. And so there is this normal process of ovarian aging, and we don't want to scare anybody. And it's not scary. It's just something to be aware of so that you can take control of your own, fertility and reproductive health. Other things that we'll want to understand about you as we're forming your plan is, how old are you? Age is very important. It's probably the most important prognostic factor when it comes to fertility and to treatments. It's the best predictor of egg quality. We will want to understand, are you in a relationship or are you not in a relationship? When ideally do you want to start trying to get pregnant, and how many children do you want to have? So the plan, the tailored plan that your provider comes up with you may be different if you want one child versus 4, and if you're planning to start next year versus 10 years from now. So again, we have to take these things all into consideration as we start to help you form a plan. This is really a lot of what we're going to focus on today and this is something that people ask me all the time. Well, what can I do? What are the things that I can do to improve my health, to improve my fertility? And we have this, as I've mentioned, this wonderful team of people who support us and support our patients in giving that information. So this, I'm not even going to go into it because we're going to spend, half of the afternoon or half of this session really talking about all of these different factors that you can control to optimize your health as well as your mental well-being as you potentially undergo fertility treatments. Options, again, this is a list of some of the options that are available to our patients. As I mentioned, often the goal of treatment is preservation. So somebody's not ready to get pregnant, but they want to do something now to increase the odds of pregnancy in the future. They want to take advantage of their current egg quality, and that happens by fertility preservation. So we'd walk you through the difference between egg and embryo freezing, which interestingly are very similar. The processes are actually identical up until the day we take the eggs out, and then that individual has to decide to freeze an egg or fertilize it to make an embryo. For those who are building families, sometimes it's just a matter of figuring out when to have intercourse. Sometimes individuals need inseminations or IVF or some of our third-party resources. There are many, many, many different paths and journeys to becoming a parent. And I think that that's important to remember, that there really isn't sort of a magic recipe, and everybody's journey to becoming a parent is very, very different. And as I said, it can be so simple as just, learning how to optimize your health and trying to get pregnant, and you get pregnant on your own within a few months of trying. And it may be, and adopting an embryo. So there's many, many different journeys and many, many different paths to becoming a parent. And what we're always advocating and what our goal is for everybody to just learn about themselves, start thinking about what their reproductive goals are so that they can be empowered to pursue that plan. So again, just in all the planning you do to not get pregnant, we just want everyone to be able to create the family that they want when they want to create it. So that is what we do here. I think one other thing, Rebecca asked me last night, do you have a quote? Like, do you have one single thing you want to say? And I think that, to speak to this idea of self-love, I do think that the emotional journey for an individual or couple who's struggling with infertility versus egg freezing is a little bit different, but both of them can be very challenging and very emotional. And I think one of the most important things, other than figuring out how to take care of yourself, which is what we're going to talk about today, is to be kind to yourself. So I honestly think that is like the best message that I can give, is to just not be hard on yourself, to be kind to yourself through the process, and know it's not your fault, right? So it's surprising, but so many fertility patients, people who are struggling to get pregnant, feel like somehow they did something wrong. They've done something wrong to be in this place, and that there's and people accidentally place blame on them all the time. Like, oh, if you were just a little more relaxed, obviously you'd be pregnant, So blame is pushed on them anyway. And then often, preservation, there's also this sense like that it's their fault that they don't have a partner, or that they have to, this isn't what they dreamed of and now they're having to do it. So I think just as best you can, kind of removing that blame and just knowing that, it's not your fault, you didn't do anything wrong, and this is where you're at, and you're gonna sort of take care of it and make a plan, and to just be as kind to yourself as possible in that journey. So that would be, she asked me for one sentence, but I couldn't put it in one sentence. So I thought I'd just throw it out there and then in those many sentences today. So that's kind of the end of where I'm going to end. We do have, again, this is a a promo deal here, which you can sort of see the details of. I have been advised by the marketing team to tell you this is a very good promo. So write down that promo code. If you are interested, if you think it has a discount both for an assessment as well as cycles, there's going to be a Valentine's Day promo, I've been told, that won't be as good. So that's your promo code. Save it if you want it. I think it's going to be on another slide too. And someone also potentially could put it in the chat for us so that it's there permanently. We do take insurance. So again, those are sort of the cash pay discounts, and we take insurance, and there's a whole bunch of people in the billing team who can tell you what your benefits are. That's the really boring stuff. So I think with no further ado, I would like to engage some of our speakers who have their own areas of expertise and their own experiences in fertility preservation and with their fertility journeys. So I think I'd like to start by talking about emotional preparation for the process. We're going to go over emotional preparation. We're going to go over nutrition. We're going to talk to our friends here who have done treatment cycles themselves about their personal experiences. So I'd love to talk to both Sophia and Shanae about what they would recommend for emotional preparation. So Sophia, since we've met you, why don't you start and share with us anything you might have to say about both someone who might be preserving or struggling with infertility, about things that they can do to prepare emotionally for fertility treatments.
Yeah, absolutely. Thank you. So I will speak for myself and say that I started meditating because I was in a really stressful part of my life. And I thought that I would, the common things, I thought that I would take care of my mind and, I wouldn't be as anxious and all those things. But truth be told, the biggest change that I have seen in my life from meditating is the amount of compassion I have towards myself and also towards others, but mainly towards me. Because the thing about meditating is that when we focus on the breath, we're getting better at being in the present moment, in sitting with the hard stuff rather than trying to run from it or hide or try and fix it. And regardless of whatever path you are on in your fertility journey, there will be things that will arise, as Dr. Brower, talked about. And when we stay in the present moment, it's a way of saying to yourself, I'm here. I'm not going anywhere. Whether you're having a great day or a bad day or an okay day, when you stay in the present moment with yourself, there's that commitment to being there for you as well as with the situation at hand. I always say, one of the most powerful things that we can do for a friend or a loved one is sit down with them and say, how are you? Like, really, how are you? And I'm staying with you no matter what. But we rarely do that for ourselves. And that's why I think meditation is a life changer and so crucial for this journey that you're on. And I can add more details in the chat and provide more details as we go. But I think the main thing I would say is don't let your ego get in the way. The most important thing with your meditation practice is to be consistent. So you can use an app, you can set a timer on your phone, which is what I used to do when I first started meditating, and just feel your breath as it moves through the body. I like to think of it being kind of a marble. When we're in a very mental place, the marble is up in our head. And when we meditate, when we feel the body breathe, the marble drops down into the body. It is a very simple practice. Just sit, eyes open or closed, and bring your attention back to your breath. That's the other last thing I'll say before I pass the mic or any other questions that anybody has is this is a practice where there's no such thing as perfection or a right way to be or a right way that things should go, because it's inherent to meditating that you're going to think, that you're going to quote unquote mess up and you'll get distracted. So a successful meditation session is just that you keep coming back to the breath. You keep beginning again. You do the best that you can. And I think applying those two premises of meditation to your fertility journey are one of the best ways that you can care for yourself throughout this process. Check in with yourself, listen to your body. How are you doing? What do you need? And also reminding yourself that it's just about doing the best you can and keep going. There's no perfect way to be or for it to go. Just continuing to show up is the best thing that you can do.
Can I ask you one quick question?
Absolutely.
I mean, I think that it feels abstract if you haven't done it. Do you have any like sort of concrete tips on if you've never meditated in your whole life and you know nothing about it? Where would you, I mean, when I did it, I took a course. I took like Inside LA is this, for anyone in LA, there's a really wonderful organization called Inside LA that does really great beginner group classes. It's like almost like group therapy, but you also learn about meditation. But in it, like, how does somebody even start this if they know nothing about it?
It's a great question. So one of my favorite apps is called Insight Timer, and I can share a link in the chat. And there are plenty of different guided meditations at beginner level. You can listen to music, just have a timer. Other popular apps include Calm or Headspace. I actually offer guided meditation classes and one-on-one meditation sessions through Kindbody if that's something that you're interested in for more of a personal approach. But kind of generally speaking, the best way to start meditating is once you have an app or a timer, take a class, is pick a consistent time of day. It doesn't have to be in the morning. Just pick a time of day that works for you. Set a reminder in your calendar, whether it be a timer that goes off or an actual meeting appointment. See if you can get a buddy or a friend to meditate with. And I would also say pick a spot that you like to go to. Some people like to choose what they would call an altar, or a place in their home that feels really special and comfortable. Other people just have a simple chair that they love. But just incorporate it into your life in a way that feels good, with consistency, starting out small. And I personally like to use apps. Insight Timer is what I use when I meditate.
Okay. Thank you.
You're welcome.
Now, Sinead, you've had your own journey. We'd love to hear from you. What are the things that you did in preparation? You know, did you have this knowledge of sort of how to take care of yourself before you started? Have you learned it subsequently? Tell us a little about your preparation and self-care that you did before your journey.
Hi, everyone. I'm reporting from this, looks like a cave. Didn't think about the fact that I'm in New York City and everyone else looks like beautifully sunlit. But yeah, mine was Sophia. You made me really like, I'm like, man, why do I have to follow Sophia? She's like, I'm meditating and sitting on a special pillow. I'm like mostly wine and like talking to my girlfriends about this. To be honest, that was kind of my preparedness path. I don't know if that's the best answer, but truthfully, for me, I'm a Virgo and like extremely type A, high energy, want to control everything. And I really just had to get myself, you know, in a mindset that this isn't a process that you can really control. You can't control the outcomes. You can't be good at freezing your eggs, which I, you know, still to this day, I think like I really was in competition with myself, which if I ever freeze my eggs again, I will do less of. But even, you know, being so obsessed with like how many eggs, what, you know, all of that, that was a really hard thing for me. So up to the day or up to the time that I started freezing my eggs, I had to really work on that. And so something really helpful for me was number one, talking to friends that had been through the egg freezing process, maybe not with Kindbody, but had just done it in general. Having their insight of what their fears were, what the outcomes were, not necessarily in numbers. I actually asked for no numbers. Highly recommend not asking for other people's numbers, mostly because it's private, but also I think it will help with the expectations for yourself. So that was really helpful, just chatting with friends. It was mid-COVID, so it was a lot of like Zooming with friends about this, but then also a bunch of people have worked with Kindbody, including myself, and most of them have a highlight on their Instagram of like their whole journey and their process. It was actually really comforting to watch people's Instagram stories as they were going through kind of the whole process for me. And it made me learn a lot before, feel a lot more secure. And also I felt less afraid of how I was going to feel, what it was going to be like. And I found that really helpful. So I think Kindbody has a bunch of the people that have worked with them, or who have kind of chronicled their journey, which I would highly advise you to watch those.
Tracy, can you speak to for a second just on, because I think that's really good advice, actually. I think that it's really, really common for people to come in and you know, I'm also a Virgo, so I understand the desire. They were trying to control my slides today. I was like, oh no.
Yeah.
I'll do that. You know, and that's, and even if you're not a Virgo, it is a common sentiment to really like have this number in mind. Like I have to get this number, and so got this number. And I really am always trying to encourage people, like, look, you got to compare yourself to yourself, right? What's your ovarian reserve? What's your potential? We're not going to compare you to the, you know, the patient in the next room or to your friends. You really have to just, compare yourself to yourself. So I think that's good. But I think also good advice is watching other people as they go through it. So Tracy, can you tell people where we keep, where do they keep that where people can see other people who have chronicled their journeys through us?
So we have on our highlights on our social media page, I believe on our Instagram, we share a lot of those stories, but where I think is great is our YouTube channel, because a lot of our panelists, something, Shanae, that you said, because when you're in a serious relationship, and when you talked about like, I don't have a ring on my finger, I'm freezing these eggs. Like it was never like when we first came together and talked about, you know, our team about like self-love, I'm all, oh, Shanae's coming. Like she's coming because she's coming in hot. And I'm kind of like you, and I'm a hybrid of you and Sophia. I really try to meditate, but I also have a glass of wine in my hand. So it's finding that happy medium. And I think something, and I always fight for that slide, is everyone's journey is unique. And I really think that it is about finding one, you know, like you said, Meredith, that you don't want to like you can't compare. This isn't a race, and everybody's journey is uniquely different. And then I think what's ridiculous to me, Sophia, is I take 2 breaths in a meditation and I'm already, my shoulders are down, I feel better. And the first thing is I'm like, you're an idiot. Why don't you meditate more? Like, it's like within 30 seconds of like those first few breaths, I'm like, what if you, heaven forbid, that you just breathe and check in with yourself every day? Like, and what a better place we should be. But I do think, you know, one, go to our YouTube channel. I think that that's so important. And because you can see different events, different presenters, and then go to our Instagram. I hate to be like, hit our Insta, but it really is a great place to find that information.
Okay, I have one more question for Shanae. So you've shared a lot of great advice, and we're very grateful. But if you did have one, it doesn't have to be one. I'm not going to limit you. You can do as many as you want. Sort of any words of wisdom advice for somebody who maybe is like nervous to even come in or is doing a treatment. Any sort of take-home message for them?
The scariest thing wasn't the actual like egg retrieval. It wasn't the shots. The scariest part of this whole thing for me was signing up for my first appointment. It was terrifying because it's almost like no news is good news. Mm-hmm. And I had just turned 35 and I had a major oh shit moment. Sorry if there are children listening. I don't think of any children using Zoom right now, but you know, I had that moment of being like, I'm in a serious relationship. My partner's younger than me. Not in like the cool way. It's like he's a few years younger than me, and he's just not ready for children. And I want a few more years as well. And that 35 moment hit me. And up to then, I really wasn't sure that I wanted to have kids. And to be honest, I'm still not. But I didn't want to have the option taken away from me. And so for me, it was about having a really secure plan. I am also an anxious person. And so having that grounding and that support of a future, whether or not I choose to grab it, was really helpful for me. And so I think, you know, conquering the fear of that first gathering of information can be really scary. But something that was really helpful for me is to kind of just be like, all right, whatever news I get or whatever information I get from this, I will have more information to be able to move my life forward. And that's a positive thing no matter what. And not knowing is, it can make you really anxious. And I will say, after that first visit, I don't think it would have mattered what my results were. I felt like my shoulders dropped for the first time in about a year as I had started thinking about all of this. And I finally felt like I was able to be like, okay, now I know what I'm working with at least. Like, I at least know how to proceed. And so if you're sitting here in this chat, or, on this Zoom call and being like, oh, I'm so scared to go to that first visit, you're not alone. I was really, really afraid. And the knowing will provide you security. The knowing, and the team at Kindbody has been awesome to just be able to support you and kind of say, okay, well then, given this information, here are options. Here's how we move forward.
Thank you so much. Thank you so much. So I think let's do one more. So one of the most common, there's some medical questions I think in the chat that we're going to get to. Tracy, do you want to do those now? We're going to talk about nutrition. Do you want to do nutrition first or medical questions?
Maybe, why don't we do our medical questions and then kind of get that, and then we can, I'm so excited for Dr. Raquel, because that will really tie in to the wellness piece that we're talking about. A few that have really been asked really around COVID, if someone is talking about, they just turned 36 and they're talking about that their employer, before they're allowed to come back into the office, they have to have the COVID vaccine. Is there any reason that they should freeze their eggs prior? Like, is there anything about doing the vaccine and fertility treatment? Like, what is kind of the current?
That's a very interesting question. Actually, just had my first consult this week where I had a patient tell me about I guess I hadn't know all these sort of misinformation that somehow the vaccine itself is causing infertility. So I think that information is out there, and there's certainly no evidence for that at all. We don't have a lot of information in general about actually having COVID or the vaccine and its potential impact on fertility. There's no reason, we don't have any good precedent in any kind of real, because coronavirus, there's many different kinds of coronaviruses. So there's certainly no precedent that that COVID itself would have future negative impacts. I don't recommend getting COVID. I think it would be much better to get the vaccine. But I think that ideally, certainly in people trying to get pregnant, it would be most optimal if you have access to the vaccine and are immune before you're pregnant. There is very good data to suggest that getting pregnant women, when they get COVID, are much more likely to become ill, or not much more, but they have an increased risk of actually becoming sick, ending up in the ICU. So if you have access to the vaccine, I would recommend that you get it. And there is no evidence and there's no good physiology to explain any potential connection between the vaccine and negative impact, or any impact at all, on fertility.
Awesome, thank you. And I know we're also learning, like, we're still like in the heat of all of this, but I think we're all working together. And I love our team, because every day you guys have been just ear on the street with our CDC and working together. And I'm really proud of Kindbody, because fertility care is essential. And when the pandemic first hit, have just been nothing but focused on patient care, because as we well know, fertility isn't something you can pause for a year at a time. And we really had to look at it and how could we serve our patients and keep our staff safe. And so I'm really proud of all of our team, and Hina, who was our PA, who joined us. We've all been, have worked, and it sounds so dramatic, but truly we've worked tirelessly to make sure that we take care of everyone. So I'm proud of Kindbody, how we have been putting that together. Next question, how critical is it to have fibroids or polyps removed before you move forward with getting pregnant or IVF and fertility treatment?
Yeah, polyps, if they are, polyps can decrease the chance of implantation. So a polyp in the endometrial cavity in a female who's trying to get pregnant should be removed ahead of trying. or certainly ahead of a treatment cycle. We know that they can decrease the chances of implantation by 50%, which is a big number. Fibroids really depend on the size and the location of the fibroid. So again, if the uterus, the inside part of the uterus is the portion where you want your pregnancy to land. So if the fibroid's on the outside, if it's in the wall and not impacting that space, then it may not need to be removed. If it's very large, if it's impacting the uterine cavity, then it may need to be removed to optimize the chance of a pregnancy for landing in the uterus.
Awesome. And then something, what someone was asking about PCOS, and again, I want to refer back to our YouTube channel because we did that wonderful 2-day event where Dr. Raquel presented as well. And we really went into nutrition and PCOS and endometriosis and talked about acupuncture. So take a look there. But the question was, people that have PCOS, like, do we have any, and I don't know if this would be in kind of our area of the world of like, how difficult is it for them to get pregnant naturally? And does that really preclude them? Like, do they really need to focus on IUI and IVF as really their means, or is there any different process or thoughts if you have PCOS and are trying to get pregnant?
Yeah, so one of the hallmarks of PCOS is infrequent ovulation. So in the most classic form, and even in a mild form, women with PCOS are often not ovulating and often not getting their periods regularly. So that requires intervention. So they will need to be ovulating, to be releasing an egg in a routine fashion to have a chance to get pregnant. And whether you just do that with sex or you do that with an insemination, or if it requires IVF, really depends on that individual. But and the other thing about PCOS is that women with PCOS suffer from obesity at a much higher rate. PCOS definitely makes it harder to lose weight, and there is a genetic predisposition to obesity, and certainly the one form of PCOS. And we know that obesity, or having a BMI over 30, is also a negative factor or prognostic factor for fertility. So certainly not all women, I'd say most women with PCOS don't require IVF. Of course, there are some that do, but in women with PCOS, the goal is always to optimize health, sometimes even optimizing health. And Dr. Raquel maybe can speak to this a little as well, because she's up next. And just losing 5 to 10% of your body weight sometimes makes ovulation and periods come back on their own and improves fertility. So sometimes it doesn't require any further intervention than that. And then sometimes it requires medication to support ovulation. And sometimes those women do have underlying infertility that requires more aggressive treatments.
Awesome. Okay, so I will no longer, let's get back, and now back to our regular scheduling program. Yes.
So I would say, we're talking about Dr. Raquel, so we're going to let her take it away. I would say one of the most common questions I get in the clinic is, again, what can I do? Like, what kind of food should I be eating? And I say, I don't know. I wish I did, but I don't. But Dr. Raquel knows exactly how to optimize your nutrition for your health and your fertility. So she's going to talk to us about that today.
Yes, thank you so much, Tracy and Dr. Brower, for having me. Shanae, Sophia, I wish every woman that was undergoing egg freezing heard from you first. This was amazing. But yes, when it comes to nutrition, my one recommendation is to always keep it very simple. I feel like social media and what we see often is very overwhelming. Should I be paleo, keto, vegan? What should I do? And really, you just want to start with the basics. So the first thing I always recommend is just making sure that you are having organic fruits and vegetables. If you can't afford organic fruits and vegetables, that's okay. You can get what is most readily available to you. But whenever you think about your plate, you want your plate to always be mostly vegetables, especially your dark leafy vegetables, because they are a natural way for your body to get rid of environmental toxins or toxins you get from food, or pesticides you get from food. If you are having dark leafy vegetables, they contain a chemical called DIM, and this DIM actually pushes out excess estrogens and toxins from your environment. So just making sure you have things like kale, Brussels sprouts. Another really good one is like cauliflower is also a really good thing to add to your plate, but making sure that vegetables comprise the most of your plate. And then if you are a meat eater, making sure that you are having like grass-fed beef, or if you really like salmon. I always tell people when it comes to cold water fish, it's so important because not only does it help to bring inflammation down that may be present, but it also helps you to naturally like regulate your hormones, regulate your periods. But you do want to be careful because some larger fish could contain large amounts of mercury. But having this fish is really good for just like making sure you're getting an adequate amount of omega-3s. So you're having your meat, you're having your vegetables. And then the really good thing about whole grains is that, as she mentioned with PCOS, a huge part of it is insulin resistance. And when you are resistant to insulin, it makes it very hard for you to A, regulate your hormones, but B, be able to implant an embryo. So if you're having these whole grains, it helps you kind of stop that insulin yo-yo. So if you're eating something that has a ton of sugar, then your insulin is going to spike. And if you don't have anything to absorb it, then your body can't naturally process that glucose. So having these whole grains is also a very important part. So those are always my basics, like have your protein, have your vegetables, a really good grain, and you design that however you like. It doesn't have to fit within the confines of a specific diet.
And can I ask a couple questions there? Two, this is maybe a silly question. If you fry your vegetables, is that okay? Or does it have to be steamed?
I feel like air frying is the new thing. But what I will say is that with like asparagus and Brussels sprouts, like putting some EVOO and like pink Himalayan sea salt and pepper and air frying it is like chef's kiss. It's so good. I wouldn't say put it in batter and fry it. I'm from Atlanta, so people probably would do that. I wouldn't say put the vegetables in batter and fry them, but if you are roasting them in the oven or air frying your asparagus or whatever it may be, I think that's okay.
And for someone who's, I mean, aside from meeting with you, which obviously wish we all could do, where does somebody, again, where do they even start? Like they want to improve their nutrition. They don't know much about, what are these green leafy vegetables? How do you cook them? How do you prepare them? Where would you recommend somebody start?
I think a really good place to start is I really like a really easy, I won't say easy, but a really great resource online is the Whole30 diet or even like the anti-inflammatory diet that's online. And I say that because it's not necessarily a diet, like trying to do keto and, pee on a stick and like freak yourself out. But what they do is that they give you very specific basics on what to grocery shop for. And the list is completely free online. And it tells you what to shop for. It shows you meals you can prepare. It shows you like things you can avoid. But I like starting there because so many things are exploited on social media and the internet when it comes to fertility. Like if the supplement line is $1,000, you don't need it. There's no amount of supplements in the world that can like outdo a really bad diet. So I always say like, if you can find resources online like the Whole30 diet, like the anti-inflammatory diet, it's the perfect place to start to help you like develop a plan for your fertility.
That's awesome. Thank you, Dr. Raquel. It's always so great. I'm going to keep moving, but I have a feeling there'll be a lot of questions for you because nutrition is always a very popular topic. I want to give Brittany and Catherine a chance to just say hello. They themselves have written a book about everything egg freezing. And one of the things that I think there's a lot of interesting things about the book, but one of the things we'd love to hear about is what you guys sort of call the Cupid effect. Because I think in my clinical practice, I see this as well. Like, and I would love for you guys to explain what it is and kind of how you think it works, because I can sort of just anecdotally in practice have seen this as well.
Yeah, absolutely. I'll jump in there, Britt, then, given that it happened to me. So this is actually kind of what started us off looking at it anecdotally. So most of the stuff in our book was rigorously researched. We earned a few more wrinkles and kind of ruined our eyesight, sort of going through hundreds and hundreds of papers and working with experts, including Dr. Lynn, your colleague, on the book. But this one thing kept on coming up in interviews that we were doing with people, and actually happened to me as well. No evidence behind it, of course, but I think it's really interesting anecdotally, which is what we call the Cupid effect. And it's this sense that so many people freeze their eggs because they haven't found a life partner, or they are in a relationship that's either very new or they're not quite sure that that's going to be the person that they want to start their family with. And after freezing eggs, something clicks into place. So 2 days after freezing mine, I went on a date with the man that I now live with, and hopefully if things go well, we'll start a family together in the future. Tons and tons of people that we spoke to had this happen, and we started digging around into it a little bit and figuring out, well, is this just coincidence? And a lot of the things that people were saying was, no, I felt like I was just relaxed on dates, and I felt like I could actually connect with someone rather than feeling kind of in my own head about it, or rather than feeling stressed out about the fact that, is this going to be the person, and like the time is running out. I think maybe that's part of it. And then maybe Dr. Brown, you can say maybe if hormones are even something to do with it. I did wonder, well, okay, I've just been injecting myself with tons and tons of what are effectively sex hormones for a couple of weeks. Could that potentially have a physical effect as well? I don't know.
I'm not sure. I mean, only simply because the hormones wear off pretty quick by the time of the cycle. I think probably what you've described is probably a lot of it too. I think also what I find in patients, and I used to actually sometimes send people to, to encourage them to see a therapist, just to help them start exploring what are they really looking for. And I think sometimes there's a coincidence too, like people are coming to this moment like, okay, I'm ready to start thinking about this. So they first come in and they preserve, but they're also start really seriously thinking about, okay, what is it that I really want in my life? What is it that I really want in a relationship? And sort of, I think helping to sort of sort that out, and is also, potentially happens at the same time.
Yeah, I definitely agree with that. I think it's only a couple of weeks, but it's a real shift can happen in a couple of weeks, because naturally you spend a lot of time reflecting, and you spend a lot of time kind of looking to the future and thinking, what is it that I want? Because you're taking this step to set in motion the future that you do want. So I think that it definitely crystallizes what you want and maybe makes you more likely to recognize it and go for it.
Yeah, I think so too. So we'll do one more question for Brittany, and then we'll let our friends that are participated ask questions as well. One of the things you guys also talk about is people who might not be sensitive, people in your life, your friends or family who are not sensitive to where you're at or what you're doing, your journey, whether it be insensitive to you not getting pregnant and telling you things like, if you just relax, obviously you'd be pregnant, or people not being supportive of your choice to preserve. So what are your tips for our patients and friends who are struggling with that?
Yeah, it's a really good question, just because, while this has been around for a little while, it's just not a universal experience. And, as we keep talking about, this is a really unique journey for every single person. And so, what the reason that one person might freeze eggs or embryos, or they're doing it for, like, I personally did it when I was married, and so I had a lot of questions, even from my family, like, TikTok, we want kids, like, why are you actually egg freezing? And it was my decision, it was our decision, and it can be hard to kind of navigate those. There's just not questions that we're prepared for off the bat. So in terms of tips, I would just say that, you want to seek out support, certainly. Sometimes I think that it can be hard to find the right person, either looking online to see other people have gone through it, maybe find one or two people who kind of share in your own perspective or your own kind of maybe some similarities in your journey. But then I would actually say, just in terms of finding like one or two people that you feel really will support you, and make sure to actually establish like a little bit of a cadence in your support system. So saying, hey, I'm going to be, going into my cycle in about a week. Do you mind if I check in with you? I don't know if I'm going to need you there, but I just want to have this system in place so that I have consistency, and I want to make sure that that person, as much as we want our parents or our siblings or our best friend to understand, maybe they're not in the same place. Maybe they don't, it's not something that they're familiar with. And so finding that someone who maybe isn't in your immediate circle, but will be a better support system, I would say that can be really beneficial.
That's awesome. That's great advice. I also think in that, like, sometimes finding someone who's been through it already. So, I think especially if you're struggling with infertility, I think it's very common to feel like really, no matter how much someone loves you, unless they've also experienced that same struggle, they don't really totally understand it. And so I think, potentially helpful to find someone who has been where you are to offer that support.
Yeah, and I think just the one last thing I'll say on that is that often when people come to you and they maybe don't have the most socially aware, kind of sentiment when they talk to you about your own situation, often it's weird if you're, going through egg freezing and you have friends who all have 3 children, they're not coming to you if they say something that seems a little, kind of not what you wanted to hear. I think just kind of taking a step back and saying, they just don't understand. This is not the place that they're in. It's okay. Not everyone will understand. And I'm okay with kind of just doing my own thing. And I think you just kind of have to prepare for the fact that, not everyone is in the same place that you are, even though they might be in your close sort of inner circle.
That's awesome. I think that's really good advice. So we could talk forever, but I think Tracy has a few things to say. And then if we have time, I think it'd be nice to take a couple of questions from our from everybody watching today. So I'm going to throw it to you, Tracy.
Sure. And something kind of topping on what Brittany said, and I know both Brittany and Catherine, I think even we've talked about this before, is, holidays are torturous. Not luckily because of COVID, but we weren't all together. So you didn't have drunk Uncle John asking you where your babies are, or why don't you have kids yet? Or why haven't you been married yet? Or, I'm having a flashback of my previous holidays. But we can't control something that a therapist had said on one of these conversations was, we can only control ourselves and our response. And you kind of have to put your armor on, and Uncle John's going to say those things. I actually have an amazing Uncle John. Uncle John, I hope you're not here, because this is not against you, but really that we can only control ourselves. We can't control what they're saying, and we have to really kind of put distance to that, and not really put any weight into that. Because I think when we're vulnerable, and maybe if I meditated more before said holiday event, I would be prepared. Sophia, I'm going to have to call you. But really is we can only control ourselves. And I think that it's really important to know that, and try not to let those other, the conversations, and surround ourselves with the positive people. And Shanae with her text and Zooms and having, who to call. It's kind of like when you dial up your friends, who's going to give you the advice you want. Like I remember I fought with a boyfriend, I would know which one who'd be like, oh girl, he's fine. Or the one, the one when you wanted the hardliner, which one of your friends to reach out to at the appropriate time. Raquel's nodding her head, because I'll call her when I'm trying to keep my hands in the air fryer and out of the fat fryer. So, but what we'd like to ask the panel, each one of you, if there was something, if you could tell yourself prior to your journey, if you could give yourself one solid piece of advice, what would you tell yourself that you now know, from your experience? So Brittany, I'll start with you since you're on the hot seat last, and then we'll kind of walk through.
I think, it's interesting. We spent like a year reviewing all these journals of, what sort of things can optimize your fertility prior to treatment. And we got very in the weeds with this. And I think, so often we feel like we need to do all kinds of things to prepare. But at the end of the day, like sometimes if not having the glass of wine is going to stress you out more than just having a glass of wine, then do it. I think for me, it was just finding that balance and feeling empowered and feeling in control in the situation at some level, but then also not becoming so obsessed with the process that I couldn't, that I was afraid to even just do the things like, a glass of wine, or, just kind of doing the things that do make me happy and reduce stress in the long run.
Absolutely. Catherine?
Yeah, for me, this is quite a personal one, so I'm not sure if it carries true for everybody, but I think really letting go of the idea that this is a second best path, or this is something I have to do because my real path isn't happening. I think that particularly when we're young, we kind of have this view of how life's going to go, and that this is some sort of deviation from that, and that can be quite isolating, and you start feeling not empowered. Whereas I think actually just reframing it and saying that sorry, can you hear me okay? Yeah, sorry Tracy, thanks.
No,
So
absolutely. No, sorry.
yeah, I was just quickly finishing with just to reframe it and start actually almost feeling grateful for it as an opportunity. It's something that didn't even exist a generation before us, and actually starting to feel like, wow, I get to do this, and feeling a bit privileged that this is an option for me, helped me to start feeling better about my own trajectory.
When clearly you're a case in point for the Cupid effect. So we can say that absolutely worked. And I was going to say, you started with a fur child. You now have a fur child with your significant other.
An outrageously fluffy cat. Yes.
Yeah.
Shanae, what about you?
So if I could go back and tell myself something, and I think it's helpful, is your partner, if you have one, can handle the conversations. And if they can't, that's their problem. I think I was really afraid to talk about this because I thought, freezing your eggs can relieve pressure for yourself, but freezing your eggs also, when your partner, brings up a lot of really interesting conversations that maybe you haven't had before. Talking about family, talking about how many children you want to have, talking about embryos versus eggs. Like, don't even get me started on the day where we had to talk about embryos versus eggs. I went with eggs because there's no ring on the finger, I'm not giving away the ice cream for free at this point, but I'm just, there's a lot of tough conversations, especially, when you're partnered, that you have to talk about the future, and it kind of propels you forward in this weird way. And I think having conversations with your partner maybe way before, even when you're starting to think about this, might be good, because sometimes it takes people longer to process. We've had it in our head for a long time. They may not have, particularly if you're dealing with a male partner. So I think for me, I wish I would have started these conversations a little earlier, than like the week I was going for my assessment. But then one thing I will add that really was helpful to me, that really made my journey fun. I mean, let's use fun loosely. I was shooting myself up every day, but I mean, I was like, I felt like a real doctor. I actually can do anything you guys want now. If you need a medical procedure, come to me, because I'm now a doctor. But one thing that really helped me was plan for those 2 weeks, if you possibly can, to inject as much fun or happiness or joy as possible. Because for me, I know stress and anxiety that can really mess with me. And I feel like, I don't know the medical side of what stress does in this process, but I assume stress is not good for the body overall. And so I actually planned a lot of fun things for myself during the 2 weeks, and I got a really nice massage before I started treatments. And then I would eat delicious food that I loved, spent time with people that I loved, make sure to decrease my workload a little bit, just to kind of make that process feel a little bit more enjoyable. Not gonna lie, you will feel totally I felt like I was waddling around pregnant. I've never felt these sensations before. You will not believe what your nipples feel like. Woo! But it, I feel like for me, making it a self-love kind of 2 weeks of just celebrating my body and myself and really doing what I needed really helped me.
I think all of those are amazing feedback, to really, and again, it's really giving that advice. And I promise you, and everyone that's here appreciates that information, because again, every day I'm someone that went through infertility treatment for an extended period of time. And I know the work that we do every day, that if I were to land on the doorstep of Kindbody today, I would have a very vastly different experience. And I know everyone here that works at Kindbody, we all do it because we love it, and we really want to create an engaged and safe, like a space where you can meet people where they are. Because everyone comes here with however you want to come and have treatment. We want to help you family building in the most inclusive space, caring space, but really meeting people where they are. So I really want to thank everyone, the panelists today. I appreciate you all so much. And thank you for taking time, because again, Shanae, what you said, it really, I mean, quintessentially, you self-loved, you got the massage, you did the things, the mask, the stuff. And I do the same thing. If I'm having a bad day, or what, even at the grocery store, I'll go in and just buy the silly, you know, whatever, Dr. Scholl's great peel or whatever it is, or however it is to make yourself feel better. Have lots of bath treats, whatever it takes. We have to be able to take, and if we don't take care of ourselves, how is anybody else ever going to take care of us if we don't even know what that looks like? And I really want to say thank you to my Kindbody team. I see Dr. Garvin, Dr. Amy. I really want to thank Shafali from our marketing team, and Sam and Jamie from CX, and let you know, it takes an incredible village to do these events, but we all love them so much. And Dr. Brower and I, prior, if we're going through the run of show, we'll be like, oh, I'm tired. But the minute you do it, it's almost a high, because we really, get to talk and connect with everybody that we really care about so much. So thank you. Thank you. Thank you. Please, if there's any additional questions, please feel free to email navigator@kindbody.com. Most importantly, and again, we're not trying to sell snake oil, but know that this is a great opportunity. It's self-love 21 is the code, and you get $100 off your consult. And I believe it's $1,000 off. Can we go back to that slide, Dr. Brower, the pricing slide really quick? There you go. So there, you get $100 off your assessment. And then it's there, as you see, it's $1,000 off egg freezing or IVF cycle. But most importantly, we said, no matter if you're trying to get pregnant today, tomorrow, or you're not even sure, oh, I see your fur baby, Shanae. Then it's, you need to know, and knowledge is power. And I can tell you from personal experience, I waited way too long. I had my head kind of in the sand, a little afraid, but we're all here and know and want to support you. And before we hang up, I'd love to, Alonza friends, we have something exciting to announce. Alonza, who wrote this incredible egg freezing book, we are going to create a Kindbody workshop to really customize a experience to give you information before you start your egg freezing journey. So we are actively working on that, and we are excited to announce that partnership. So stay tuned, because I'm sure we're going to bug everyone and have another event or an IG Live to talk about that once we launch that project. But Sophia, Dr. Raquel, everyone, thank you. Any closing comments, Dr. Brower?
No, just again, thank you so much to everyone for sharing their perspective and their knowledge, and we appreciate you.
Yeah. All right. Big love, everybody. Thank you so much, and we'll see you soon. Thank you.